Have you ever looked in the mirror and noticed your face looking suddenly swollen or puffy? It can be scary, right? Facial swelling can happen for many reasons, from something simple like lack of sleep to serious medical conditions that need urgent treatment. Before we dive in, don't forget to subscribe to this channel and share this video so more people can learn about important health topics. In today's video, we'll understand what facial swelling actually is, different severity levels, common causes of facial swelling, treatment options at home and by doctors, when you should consider facial swelling an emergency, and finally, prevention tips to reduce the risk. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRC PUK, medicine specialist, diabetes and hormone specialist. The information has been collected from various medical books, reputed journals, and trusted medical websites. Facial swelling, or facial edema, means fluid has built up in the tissues of your face. This can make your cheeks, lips, eyelids, or even the whole face look puffy or bloated. Sometimes the swelling is only on one side, and sometimes it spreads to your neck or throat. The severity can range from mild to severe. For example, if your face looks a little puffy in the morning and goes away in a few hours, that's usually not a concern. But if the swelling lingers, keeps getting worse, or happens suddenly, that can be a warning sign. So, what are the causes? There are many. 1. Allergies, reactions to food, insect stings, medicines, or pollen. Sometimes this can be mild, but in severe cases, it can lead to anaphylaxis, a life-threatening reaction where your throat swells and breathing becomes difficult. 2. Infections. Sinusitis, cellulitis, eye infections, or even dental infections like a tooth abscess can make one side of your face swell. Infections are often painful, red, and warm to touch. 3. Injuries and trauma. A broken nose, jaw fracture, or surgery around the face and neck can all cause swelling. 4. Medical conditions. Angioedema, sudden, painless swelling of lips, eyes, or tongue. Cushing's syndrome. Too much cortisol hormone causes round, puffy face. Hyperthyroidism or hypothyroidism. Thyroid imbalance can cause swelling around the eyes. Kidney or liver disease. When these organs don't work well, fluid builds up in the body, including the face. Lupus and autoimmune diseases cause inflammation and puffiness. Preeclampsia in pregnancy. High blood pressure leading to swelling. 5. Salivary gland problems. Blocked salivary ducts, salivary stones, or infections can cause swelling near the jawline. 6. Tumors and lumps, benign ones like lipomas, fatty lumps, or cysts. Enlarged lymph nodes due to infections or sometimes cancers. Other day-to-day reasons include too little or too much sleep, high-salt diet, excess alcohol, hormonal changes around menstruation. Now, let's talk about treatment. Treatment depends on the cause. For allergies, antihistamines or corticosteroids. Severe reactions may need epinephrine, EpiPen. For infections, antibiotics or antiviral medicines. For injuries, cold compress, pain relievers, and sometimes surgery. For thyroid or hormonal conditions, correcting the underlying hormone imbalance. For kidney, liver, or heart-related swelling, treating the primary disease with medicines and diet control. For blocked salivary glands or abscessed tooth, sometimes minor surgery or dental treatment. At home, you can try keeping your head elevated to reduce fluid buildup, applying a cold compress to ease swelling, using pain relievers like paracetamol or ibuprofen if there's discomfort. But remember, home remedies are only temporary. If swelling is new, unexplained, or painful, see a doctor. When is it an emergency? You must rush to the emergency if swelling comes suddenly with difficulty breathing or swallowing. You were bitten or stung by an insect and your face starts swelling rapidly. There is a burn, injury, or infection with fever and severe pain. Prevention. Tips. You can't always prevent facial swelling, but some steps reduce risk. Avoid allergens and foods you are sensitive to. Reduce salt and alcohol intake. Practice good oral hygiene to prevent dental abscesses. Eat nutrient-rich foods with fruits, vegetables, and whole grains. Manage stress and get adequate sleep. Facial swelling means fluid accumulation in face tissues. Causes range from allergies and infections to thyroid, kidney, liver, and autoimmune diseases. Treatment depends on the underlying cause, from simple cold compress to antibiotics or even emergency care. Always see a doctor if swelling is sudden, severe, or associated with pain or breathing difficulty. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCPUK, medicine specialist, diabetes and hormone specialist. The information has been collected from various medical books, reputed journals, and trusted medical websites. Don't forget to subscribe and share this video so that more people can learn how to take better care of their health.